This presentation is sponsored by the Griffith University Allied Health Physiotherapy practice located on Level 4 of the G40 building on the Gold Coast University campus. This video will provide a brief summary of lateral ankle sprains and whether or not this could be the source of your pain. A lateral ankle sprain occurs when the foot rolls down and inwards, which can stretch or tear the ligaments on the outside of your foot, resulting in pain. Lateral ankle sprains are one of the most common sport-related injuries and throughout the general public. Some common causes of spraining your ankle include walking on uneven surfaces, participating in a sport that requires a sudden change in direction, or incidents when someone steps on your foot during a sporting activity. There are 3 ligaments that could possibly be injured during a lateral ankle sprain. These include the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. These ligaments support the outside of your foot and help to stabilize the foot. Ankle sprains are divided into 3 grades ranging from mild to severe depending on how much damage has occurred. Grade 1 ankle sprains are classified as slightly stretched ligaments. There is mild pain and swelling, however you'll still be able to walk on it. Grade 2 ankle sprains are classified as a partial tearing of one or more of the ligaments and is associated with moderate pain and swelling. It will be tender to touch and walking becomes more difficult. Grade 3 is the most severe ankle sprain and is classified by a complete tear of one or more ligaments. It will be very swollen and feel unstable, and you may not be able to walk on that foot. Physiotherapy has been shown to be the most effective intervention for lateral ankle sprains. Treatment is based on ensuring tissue healing and restoring full function. There are 4 stages of the tissue healing process. These include the inflammatory phase, proliferative phase, early remodeling phase, and late maturation and remodeling phase. Initially, after the injury to the tissue, you may see some swelling around your foot and it can be painful. This is a normal response to injury and the start of the first healing stage, the inflammatory phase. Inflammation is your body's response to tissue injury, where there is an increased blood flow to your ankle containing special healing cells. During this stage, it is important to protect your ankle from further injury and managing pain and swelling by applying the RICE protocol: rest, ice, compression, and elevation. During the proliferative phase of healing, a physiotherapist can help introduce gentle exercise to restore full range of motion in the ankle and can apply taping for stability and proprioception to help retrain your muscles. During the early remodeling stage of healing, a physiotherapist will prescribe an individualized strengthening program and introduce balance and proprioception skills to increase motor awareness and control of the ankle. Finally, in the late remodeling stage, a physiotherapist will introduce coordination-type exercises and skills that are specific for your goals, such as returning to sport safely or appropriate to your needs. Using this exercise program, a physiotherapist aims to reduce further damage and prevent recurrence. The team at the Allied Health Clinics are experts in assessing, diagnosing, and treating musculoskeletal conditions. If you believe you're experiencing symptoms of a lateral ankle sprain or uncertain on the source of your foot pain, do not hesitate to make an appointment with the friendly physiotherapy team today.